I have the pleasure to welcome you here to a session hosted by the Federal Ministry of Health, Germany. I'm not going to say much, I'm just going to say why we host the session. The session is about finding a consensus on an international pandemic accord, and as you will have seen, moving into this building, there's nothing more controversial than the pandemic accord, I would say. Outside WHO, but also inside WHO. It feels, looking a little bit at the crowd here, it feels a little bit like a family reunion of the German government, because we have all the different ministries that are involved here, but also all external and international partners. So we try to pick a controversial theme. We hope for a really controversial debate to be well informed when we negotiate further in Geneva. So thanks a lot, and it's a great pleasure to have Suri Moon here as the chair from the Gradient Institute. Over to you, Suri.
Thank you so much, Bjorn. Welcome, everyone. As you've heard, we're here to have a very lively and open and controversial debate. Indeed, I've been given my marching orders, which is to not shy away from difficult issues and questions, and our panelists are very well aware of that. Maybe I can just begin by kind of giving you a lay of the land, how we'll be spending the next bit of time together. I can see that there is tremendous interest in this topic. We literally have standing room only. I think there might be a few open seats in case anyone would like to take them, including a couple up in the front of the room, so please come and sit down, those of you who are standing, so you can be a little bit more comfortable. We have 90 minutes to spend together. And before diving in, I really want to thank our colleagues from the World Health Summit, from the German Federal Ministry of Health for all of the support in organizing this session. They've been a tremendous support to me, and it is my great honor and pleasure to be here with all of you. What I'd like to do is kind of lay out the scene a little bit, lay out some of the context before we dive into some of the nuts and bolts issues, and we have time for at least a couple rounds of questions to each of my speakers, and after that we will turn to the floor. There will be no questions coming in online, so it's really up to all of you who are here in the room to pose tough questions, and you're very welcome to do so, but I do ask you to keep your questions short and to the point, and of course to let us know if there's a specific speaker that you would like to target your question towards. So you will certainly have time, and we'll try to, it's my job to manage the time well, so we have indeed plenty of space for back and forth with all of you. And so we'll open the floor probably in about 40 minutes to the floor here, to the group here. So let me begin, as I mentioned, with just a few comments about the context within which these negotiations are taking place. In my view, the negotiation towards a pandemic accord is one of the most, if not the most important governance process happening in health right now, and I think this is certainly a view that many of you may share, and that's why you're here today to hear about this. We have a self-imposed deadline that member states have set for themselves of May 2024, which is really around the corner. A huge challenge for everybody, all countries, all negotiators, all stakeholders, made even more difficult by the fact that we're not just trying to get across the finish line with a pandemic accord, but at the same time also trying to amend the international health regulations, which of course are the pre-existing set of rules that are supposed to govern cross-border disease spread. So a huge challenge for everyone, and I'm sure we'll be hearing a bit more from everybody about their thoughts on the May 2024 deadline. Clearly, there is a lot of hope and ambition and legitimacy that is instilled in the IMB process. And let me just say, this is the acronym that I'll use to refer to the pandemic accord negotiations. We heard this in New York. Just a few short weeks ago, there was the high-level meeting in New York on pandemic preparedness that ended up with a declaration that for many, and including in my own opinion, more or less reaffirmed previously agreed principles and really kicked the ball back to Geneva and said the hard decisions need to be made in Geneva by the IMB and by the working group on the IHR. We've heard it again in debates around the proposal to create an interim medical countermeasures network or platform within the World Health Organization, where again a number of voices have said, let's kick that can back to the IMB. We want the IMB to decide on a number of the most difficult issues. And so clearly there's a lot of weight and expectation on the agreements that our member states hopefully will be able to reach soon. These negotiations are taking place in a very difficult context, a very difficult geopolitical context. I think I need not go into great length regarding some of the tensions and the mistrust, of course, that came out of COVID-19 that have been exacerbated by the Russia-Ukraine war, that are being exacerbated again with the events just of the last week, with a potential explosion of the Israeli-Palestinian conflict, intense polarization within and across countries being reflected in developments such as a Congress in the United States that is not able to function, as well as tremendous mistrust in the pandemic accord itself. As many of you saw when you entered the hotel, we have protesters outside the door who are very concerned, actually, about what a pandemic accord may mean for some of their daily lives. And so this is a very, very difficult context in which to try to get almost 200 member states to agree on something meaningful, something binding, something that will make a big difference and actually be acceptable to everyone. Last but not least, these negotiations are taking place against a backdrop of what I would call a big power shift, what some people have called a shift to a multipolar system, where countries that used to be less powerful at the international level are increasingly flexing their muscles. We have realignments of political coalitions and constant shifts, including on a number of important and sensitive technological areas. And so all of this makes it very, very difficult. The short timeline, shifting power dynamics, geopolitics, and yet, as I mentioned before, everybody is watching the IMB process. And the timing of the session could not be better because, as many of you know, tomorrow we are expecting a new draft, what I understand is going to be called the negotiating text. I'm not sure how much we'll hear about this new draft today. Hopefully, maybe a little bit of a clue as to what we can expect to see, but much will certainly ride on what's in that new draft. Now, this is the context within which we're diving into this discussion. Let me actually begin without further ado. I'll introduce each of our panelists as I pose my first question to them. They're an informal bunch. Everyone has agreed to be called by their first name. So I will do that, and I'm going to begin to my immediate right with Paco. Dr. Francisco Perez Cañado, who is here representing the European Union, representing DG Sante, where he is the he coordinates the work on the global health strategy, which I think has gotten a lot of attention lately, has a long experience working on international partnerships, and comes from a background in trade, where indeed negotiations have also always been very, very difficult. And I hope that you will indeed bring some of your insights and successes coming from the trade sector and help us get across the finish line for the pandemic accord. So let me pose a very first question to you, and in this first round of questions, we're going to get some general impressions from all of our speakers on what is the potential for change, what do you hope that this pandemic accord can actually achieve. And so I'm going to begin, Paco, with you. So the European Union has been a very strong voice initially calling for a binding agreement that helped to, in fact, bring us to the point where we are now. It's been a strong voice in the negotiation process. What do you think realistically can actually be achieved, and are the negotiations going in the right direction?
Well, thank you very much, Suri. We've been asked to be provocative, so let's start by doing that. The question behind your question is, do we need an agreement? I mean, at the end of the day, we're all trying to learn, all partners around the table, the hard lessons of the pandemic, and we're all taking measures to close the many gaps that exist in prevention, in preparedness and response, and also to try to close the equity and inclusiveness gap. So, for example, the European Union has been just to give you one example, we have been engaging with our African partners in order to have a very concrete 1.2 billion euro initiative to deliver on the diversification of manufacturing, which is so essential to solve the equity gap in PPR. So do we need this as such? And the answer is absolutely yes. From our perspective, knowing that this is a choice. We can have an agreement, or we can continue along the line of bilateral collaboration. An agreement will be fundamental for us in two ways. First, because we have to recognize the first victim of the pandemic in political terms was a trust amongst international partners. And the only way that we can rebuild that trust and really solve the problems across the board in the PPR spectrum is to have something in writing and to have something that achieves a fundamental objective. There's an improvement in closing all of those very important gaps, and also very clearly outlining what the benefits would be for the global community, but in particular for low and middle income economies. This would be the best way to show that in the next phase of our collaboration will be not about charity, but about solidarity. And in that sense, a lot can be done in the pandemic agreement. I want to make, of course, a little bit of advertisements for the kind of proposals that the EU has put on the table, because it gives an indication of the degree of ambition and the degree of results that we can get. And these are, first, obligations, point number one. Obligation, trust is based on obligation. Second, very concrete, and third, very effective. They yield concrete results, improving the situation on the ground. What kind of ideas have we put on the table? The first pillar of equity is not equity in handling disease, but equity in preventing disease. So we have suggested very strong provisions on prevention, on outbreak surveillance, on rapid control of outbreaks, all with a One Health approach and with strong AMR provisions, because, please, we cannot leave gaps. We have an opportunity right now, which is generational. We cannot leave gaps for pathogens to get through. And this is the most important part. I mean, in our view, this is the most important beginning, if you want, of the discussion. Second, we need far-reaching, innovative obligations also, which will empower low and middle-income economies to support their health sovereignty and achieve an enhancement of equity in countermeasures. And there, what can be achieved? Well, what have we proposed with very concrete ideas? First, extend the capacity nationally and regionally for R&D. Second, extend manufacturing capacity with regional diversification. Third, enhance technology transfer, exploiting fully the power of voluntary exchanges. Fourth, set up also stockpiling, which is done on a regional level in order to make sure that we can properly respond. However, this will not be enough, if you want, because we are not going to be able to produce countermeasures in every country, even though, let me tell you, almost every partner that we speak to wants now to set up a new vaccine facility, for example, which is not possible. Autarky is not the solution, but connection and collaboration. So in addition to that, we have suggested also very strong availability and affordability measures, so that we can have, through reserving volumes of countermeasures, plus setting price caps for low-income economies and tiered pricing for middle-income economies, that we can ensure that those which are not producing will have access. So these are just some examples of what we can deliver. The ambition is high, and the European Union is very much engaged in this process, even though, and I'm going to finish with this because I'm seeing that you want to kill me already now for speaking too long. I want to finish with this. One of the paradoxes I think that we're facing is, it was the EU and its member states with other partners who suggested this in the first place. And the funny thing about this is that we are seeing as if this were an EU project. That would lead it to failure. This is a project based on shared interest and shared responsibility amongst all of us. Otherwise, it won't work. We can go home. No problem. And in that sense, and it's this with this spirit that we move forward. You had a question also on where we were in the negotiations, right?
How are they going?
How are they going?
Direction? Briefly, please.
In the right direction. I have to send a big kiss to the lady 2 steps down. Because the work of the co-facilitators in the informal sessions that we have had in Geneva has really made a hell of a difference and a sea change. The reality was that at the beginning of the negotiation, we had almost ideological stances. Only formal sessions and ideological stances. Why? Because the trust has been broken, as I was saying before. And thanks to the informal sessions that colleagues like Juliana have so aptly mediated, we started to talk to each other. We started to try to understand what our differences are. We started to try to find points of convergence, also of divergence. And so we are at a point in time where if the negotiation text brings on board all the good work and all the convergence and ideas that these wonderful guys, the co-facilitators, have put together on the basis of our informal discussions, we'll be on the right track. Great opportunity, Suri, great opportunity.
Thank you. Thank you for both the positive energy and the enthusiasm and putting on the table, indeed, a number of the key issues already. I see we're diving right in and not wasting any time, and that's a perfect segue for me to turn to Steve Solomon, who is the Principal Legal Officer of the World Health Organization. I sometimes think of him as the person in the center of the storm, because he has been intimately involved, I would say, with this process from the very beginning, and is really the perfect person to inform all of us today on how things are going. He's been with WHO for a very long time, including having been directly involved with the Pandemic Influenza Preparedness Framework, the PIP framework negotiations about 12 years ago, well, 15 years ago now, depending on when you start counting, and formerly was with the US State Department and a practicing lawyer. So Steve, let me turn to you and pose two questions. I think Paco has already put on the table a number of the most controversial issues, actually. Could you kind of give us a rundown of what you see as the key issues, the most difficult issues where we need to reach agreement? And what does the conclusion of an accord mean for WHO's role in the broader global health system?
Thank you, Suri. Thank you also to the organizers. It really is an honor and pleasure to be here. If I could start, given our directive to be provocative, by saying, Paco, I don't think it's a provocative proposition to say that this thing can be done by May 2024 and it's doable. But we can talk about that. But the reason, the evidence basis for that is not only how it's going with the co-facilitators, not only what has been developed so far, not only the role of the Bureau, not only the commitment of member states, but the fact that we have a really important historical precedent for getting important treaties done quickly. The WHO Constitution, the founding document of the organization, was negotiated in 1946 in 6 months. We have 7 months left and almost 2 years under our belt already about thinking about this. So this is doable if member states have the political will to do it. And so the Secretariat is supporting that process. And I think the point about contentiousness is probably best looked at as where are the areas where it's key to find common ground in order to deliver in May 2024. And I think there, from the discussions of member states, from the way the co-facilitators groups have been organized, the way the Bureau is looking at this, because this is a member state-driven process, first, foremost, and across the board. And I think there are 4 key areas where, if common ground can be found over the next period, it's possible to get an instrument that will truly operationalize equity. And that is the overarching objective. And those 4 areas are, first, and then I'll expand on them in a bit, but let me give you the 4. A meaningful pathogen access and benefit sharing system. Secondly, a more sustainable and distributed production capacity globally. Third, strengthening national health capacities in a number of areas. And fourth, and maybe most importantly, the not-so-secret sauce of any implementable binding agreement, governance, financing, and political will. So if common ground can be found in these 4 key areas, I think there's good prospects for an instrument that will truly operationalize equity. And I should say instruments, because the work to strengthen the IHRs which is happening in tandem, is critically important. And this is a big deal in the sense that governments within the framework of WHO have never before taken on the task of working in two normative, legally binding areas to respond to something as big as the COVID-19 pandemic has been, and as awful as it's been in so many ways in its impact. So let me unpack a little bit, with your permission, if I have a bit more time, what each of these four terms mean. What does meaningful pathogen access and benefit sharing mean? Well, it means first that the sharing of pathogens and the sharing of benefits should be on an equal footing, meaning binding and binding. Obligatory sharing of pathogens, including the genetic sequence data, obligatory sharing of the benefits that arise therefrom in the form of pandemic response products, vaccines, diagnostics, pharmaceuticals, countermeasures, the tools for responding to pandemics. It means, secondly, that meaningful means inclusive. It means all countries participating. It means stakeholder involvement across private sector CSOs. And then the third thing I think that meaningful PABs means, and again, this is the direction of travel amongst member state discussions, is that the access to those pandemic response products for WHO should be in real time. Late is, there's a saying, justice denied is justice delayed. Quick access denied is all access denied. So timing is important, real-time access, and that for whatever part of the access to pandemic response product there is, it should be distributed based on public health need and risk and not just purchasing power. So those are the components, I think, of meaningful PABs that has been discussed. Secondly, the substantial and distributed production capacity. This means addressing and finding common ground on important issues like intellectual property rights, like IP flexibilities, like the ability of countries to use existing flexibilities under TRIPS, under Doha, in ways that are meaningful for their use and in ways that safeguard their use when they feel it is necessary. It means also sustainability means long-term viability of production capacity, meaning there should be support of, including with respect to market-driven support. There needs to be disease burden studies to support the sustainable production capacity that is distributed globally, better globally. And with distribution, the importance not only of geographic distribution, that is critically important, but distribution mindful of producing countries' ability to export. So if there are smaller population countries which have more of a capacity for export, this will be an important consideration in going forward to ensure that there is sustainable and well-distributed manufacturing capacity. Third component, stronger national health capacity. This means capacity strengthening in areas like, first and foremost, health systems, in surveillance and risk assessment capacities, in supply chain and logistics capacities, and in regulatory capacities. These are ways to operationalize equity. And finally, this not-so-secret sauce in terms of governance, financing, and political will. Governance has to be inclusive. The collaboration among states, among IGOs, among all stakeholders, critical. It has to be transparent. The public needs to be aware of what is happening, how it's happening. They're informed. We see what's happening outside. The power of transparency and information to address concerns, many legitimate on part of the public about what's happening, will be very important to good governance, and good governance means also accountability. Financing has to be sustainable. Lots of discussions. Bjorn just moderated one of them. Critical to the successful implementation of any agreement. And then finally, political will. The issue with political will is there are two risks, I think. The risk of political amnesia, the forgetting, sometimes willful forgetting, of the impact of what happened that can drive change. And the other aspect is the potential for political shift away from multilateralism, away from looking at global solutions for global problems. This will be very important to address in order to secure political will for the next 7 months to provide for a delivery. The risk of not acting is that the loss of political will mean it will be harder and harder to get these kinds of tools and mechanisms to ensure that there is real operational equity delivered over the long term.
Thanks very much, Steve. You've given us a fantastic summary and overview of really many, many issues on which we need to reach agreement. I want to turn to somebody who is responsible for helping us to get there. So our next panelist is Maria Juliana Tenorio Quintero, who is the Minister Counselor with the Colombian Permanent Mission in Geneva. She is one of the magic makers that Paco referred to earlier, one of the co-facilitators on one of the articles that is arguably quite difficult, including covering intellectual property issues. We'll come to that in a minute. And she is a legal expert with a PhD in international law and has been working almost 2 decades for the Ministry of Foreign Affairs of Colombia. So let me turn to you, Juliana, and ask you, as a member state representative, as a negotiator, how would you describe the current atmosphere in the negotiations? Do you think there's space for agreement? Also, are we moving in the right direction? And what is it that you think is necessary for the accord to be successful?
Good afternoon, everybody, and thank you again for the organizers for inviting me. And thank you, Suri, for all these provocative questions. First of all, like we have seen that this is not the first multilateral process in where member states have been involved in we have experience of member states dealing with difficult issues. So when I arrived to Geneva, because I've been dealing with this process for a year now, that you see that every multilateral process has a reason to begin with. So in every time that states decide to open up the discussion, to limit their sovereignties, to have common standards, is because they decide that there's a need of having clear and common standards to regulate things. So in terms of the pandemic accord, we don't only have this need of regulating health emergencies, but we also had a tremendous experience with COVID-19. So we experienced many difficult things during pandemics, and we've seen how the rules that we have built in the past to deal with health emergencies didn't work as we expected, right? So that was the main thing that brought us together in order to negotiate not only the pandemic treaty, but also the amendments of the international health regulations. So I will say that the environment in the room is of urgency. So urgency, member states and negotiators are quite aware of the task that we have on our shoulders, and we are aware also of the small limit of time that we have. But we imposed ourselves that deadline because we saw that it was very urgent to come up with new rules or an enhancement of rules, that pre-existing rules in terms of the regulations. So the negotiators, having in mind that sense of urgency, are just trying to talk to each other, just to try to listen to each other. And at the beginning, it was very difficult, as Paco was explaining, because then to be honest, in the World Health Organization, there is only one framework convention and then tobacco control and one protocol. So it's not an organization where you will have an experience of negotiating treaties as you will see in other forums. And so negotiators that tend to be permanent representatives of the missions there in Geneva were not used to have this kind of conversations. So, and I have to be honest, at the beginning it was hard. But then we started to listen to each other. We started to realize that we weren't negotiating just resolutions to be adopted at the assembly. That was like the main modus operandi of permanent missions there and before WHO. So we started to realize that we had to change a little bit the form that we talk to each other, and that we needed to have clear binding obligations, and that we were negotiating a legally binding instrument. And in the process of having these conversations between each other, we realized that we had to go from these general statements to the concrete things that we needed to do. And we will talk more about this I think during the conversation. But since this is a member state-led process, we kind of, and there's also a bureau, of course, like that is leading the conversation. We also tell the bureau, like, look, like, of course, you have to have in the pandemic treaty many provisions, but then again, you also have the heart of there are some provisions that are the heart of the agreement, and that we needed to focus on those. And those are the provisions that Steve was just recently mentioned. Those 3 to 4 to 5 provisions being the heart of the conversation. We told the bureau, like, let's focus on those and let's have co-facilitation sessions. So that is like the conversation, how is the conversation is going. So we started having this from A to Z, from the conceptual zero draft and zero draft, like going from Article 1 to Article 39, to go into very detailed conversations in the middle of this year, just trying to focus on what is the heart of the agreement. And the heart of the agreement is like the mandate that initiate the process, and and that mandate was how to operationalize equity. And so I think what is going to be the new thing or the key thing that the accord should have are those provisions that operationalize equity, and not equity in philosophical terms, like equity in practical ones. Because the member states have been evolving from discussing equity in these general terms and going to the nitty-gritty of what would equity mean. And irrespective of, member states should have, irrespective of its location, income, legal regime, etc., have to have the same capacities to face health emergencies. And the only way to do that is the provisions, is by having clear provisions on the things that Steve already mentioned. That is access to technology, a clear access and benefit sharing system, and a very strong supply chain, and of course capacity building for all member states. So I think that we're getting there in matters of the conversation. It hasn't been an easy process for all the other things that I already mentioned to you. But I think right now we sense the kind of, we know the positions of each other. So I think when the new text will arrive tomorrow, since we already know what everybody is thinking, we can have like a meaningful discussion of how to end the negotiation and how to have like clear legal binding obligations within the agreement. Thank you.
Great. Thanks so much. A lot of impatience for this new text tomorrow, indeed. Anyway, we'll come back to that. Let me turn now to our fourth speaker on the panel, last but not least, Professor Dr. Lars Schade, and congratulations, as of about 10 days ago, I believe. He is the new president of the Robert Koch Institute. He's been there for a number of years. I think in comparison to the rest of us who sort of float in this funny world of policy making, I would say he's been very much on the ground, helping his country to respond to outbreaks, public health crises, and I'm hoping will bring us a reality check from a much more concrete operational perspective. He has been the head of the Robert Koch Institute Center for Biological Threats and Special Pathogens for over 10 years, was also within the Federal Ministry of Health before joining the Robert Koch Institute, and has also been in academia before then. So let me now turn to you and ask you, Lars, a couple questions. If we think back, looking backwards during the most difficult days of the COVID-19 crisis and what happened here in Germany, what are the rules, the international rules that did not exist, that you wish had been there, that would have helped you and your colleagues to mount a more effective response?
Yeah. Thank you. So it's not an easy task, because these the already made statements were so elaborated and comprehensive, so I can hardly add something new, but I can of course re-emphasize certain things from the perspective of a National Public Health Institute. And the first thing we would really wish us a kind of more binding character and more compliance with existing rules. For example, the international health regulations, they contain a lot of good rules, what we need is a mechanism to ensure compliance with them. And this, I think, it should be clearly addressed in the pandemic agreement. And this is especially true, for example, for information exchange. So enhanced international and regional exchange among the member states and organizations is necessary, and this should be, of course, be done in a trusted network and in a trusted environment. And maybe we can secure this by creating reliable platforms for the member states to exchange their information. For example, maybe a kind of model for this exchange, the European Early Warning and Response System, which works quite well. It's not perfect always, especially when there's a lot of information that is exchanged, but it is a trusted network, and the member states are, on the other hand, obliged to put something in it. And of course, what was already as well mentioned, equity is quite important. We need the discussions and the agreements on how we tackle a better rollout of vaccines in future and other pharmaceutical interventions, for example, it's already mentioned. And these agreements need to be so strong and accepted that the expectation of the public and the politicians can be guided by these pre-existing rules. It's a big task, but you have already mentioned, Paco, some of the possibilities to bring it on the way. And of course, from the public health, it was also mentioned capacity building in the health systems. And with a look on public health workforce, it might not be astonishing that I would really like to argue for strong, scientifically independent public health institute in all member states. And maybe the pandemic agreement can formulate some minimum standards on core functions and infrastructure in these public health, national public health institute, and as well create a mechanism to ensure the support of the countries between each other. Thank you.
Great, thank you very much. And I heard you emphasizing certainly at the beginning of your comments this need for binding rules that are really complied with, that there are strong accountability mechanisms. And this brings me back to, I think, reminds me of one of the comments, Steve, that you were making about some of these arrangements that you need for all treaties, for all sets of rules in order to make them meaningful. And I think this is one of the biggest critiques of the international health regulations, indeed, that they had plenty of legally binding provisions, on paper legally binding, but what we saw during COVID was many governments simply did not fully live up to their obligations for the IHR. If I may, I just wanted to come back for one moment before we turn to our second round of questions and come back to you, Lars, because I think you raised an issue that touches on what both Juliana and Steve and also Paco touched on, which is this issue around ABS, as we call it, access and benefit sharing. And I think you spoke about the importance of binding obligations to share information. Do you think it's reasonable? Is it accepted, for example, that would come with binding obligations also to share, for example, vaccines, technology, intellectual property, etc.?
To combine it, that's the question. Okay, yeah. Yes, in a way it's necessary. If you think, for example, for sequence data, you need sequence data to produce vaccine, and the people who provide sequence data or even biological specimen, they have to have a benefit from it. And of course, if you don't if you get nothing back, this creates a problem. But I would like to mention another part or another circumstance that was quite that struck me during the COVID-19 crisis. And this was the example of South Africa. South Africa very, very frankly reported the new sequence data on Omicron and on the new variants. And the result was the flights were cut. And this is something that is, of course, absolutely counterproductive. In a country that that is frankly and openly and transparently sharing information on cases, on sequence data and so on, and what's going on in their country. This can't be punished by the world community for doing that. If this will still happen in future, I'm afraid we will not have a sufficient and needed and kind of transparent data sharing.
And is it realistic to expect countries to agree not to impose, for example, travel restrictions if a similar situation would come up again? This is actually an open question for, for all the panel members. This is certainly one of the debates. We've not actually mentioned travel restrictions so far today, but this is certainly one of the proposals that was put on the table, that we try to strengthen that restraint on countries in order to encourage others, indeed, to share information, as happened during the Omicron wave. Would anyone like to jump on that? Does there seem to be will among, for example, EU member states?
I'm coming first, Suri. No worries. It's looking at me from the beginning. No, I think what we certainly have to make sure that, I mean, this is a very delicate issue, because on the one hand, we have to ensure the necessary safety for our citizens at home. So I think that the target would be to find the right balance. Because what we cannot say to any of our constituencies, and I suspect that Juliana would be in the same position, is because we want to enhance transparency, we are going to put our citizens at risk. And I think that as you know, governments and political organizations is simply not acceptable. At the same time, we do feel a lot of sympathy for what our South African colleagues went through, and I think it's common work to try to find that right balance between enhancing, well, absolutely necessary to enhance transparency, while certainly making sure that all our citizens are safe everywhere.
Indeed, I think some of these difficult questions around the efficacy of travel restrictions, what kinds of restrictions may or may not actually reduce risk, that has made this a difficult issue. But I want to turn, we could spend the whole day talking about travel restrictions, let's not do that. Many of you were actually quite optimistic, I would say, more optimistic than I predicted. Let me be honest about that. So that gives us hope for next May. I'd like to spend the second round, before we open up to the floor, focusing indeed on some of the most important obstacles that are still there, that have to be overcome indeed if we are to reach a meaningful agreement. And what I'd like to do, Juliana, is to turn to you next. As I mentioned earlier, you've been one of the co-facilitators, one of 3 countries co-facilitating the negotiations around Article 11, which includes intellectual property, long I might call it the third rail in global health, oftentimes a very hot topic for at least 2-3 decades, if not longer. And I'm curious to hear your views about how do you think agreement can be reached, considering where countries are and the long-standing difficulties around this. What might help actually to find that common ground that Steve was mentioning earlier?
Wow. So I think first of all we need to start by explaining a little bit of what is co-facilitating. So it's not new to other multilateral processes. But there's I'm seeing a bit of a difference in WHO process. So whenever you have co-facilitations in a multilateral process, that means that that is a difficult issue to discuss. So be the presidents, the bureau, whoever is directing the process, and sees that there is a very difficult situation or issue to get consensus on, so he or she appoints member states or that are experts on the matter at hand, and they try to say to those experts or member states to try to help to reach consensus, and they are appointed as co-facilitators. So that's one of the answers to your question. So indeed, Article 11 is one of the most difficult articles in the agreement. I think along PAPs, those are the 2 difficult issues here in the agreement. But in WHO, there's another difference, because here, co-facilitators, of course, were appointed by the Bureau, but they were requested by member states. So again, this is a member state-led process. So member states decided in June, and seeing the speed of the conversation, that it was useful to have some member states going into in-depth discussion of these difficult articles. And which articles were going to be? Again, the ones that Steve mentioned, that those are the heart of the pandemic accord. So in June, member states decided that why don't we start, and we told the Bureau, why don't we start a conversation with co-facilitators? And we started with Article 9, because we believed that was the easiest. So they were the guinea pigs of this process, and we wanted to have positive reactions in co-facilitation. And that went well. And then we decided, like, okay, Article 9 went well, so why don't we move on to other most difficult articles? So we have PAPs and supply chain in the first set of co-facilitation. And that went well, because we have in the intersessional period between June, July, not so much August. And then we arrived into the September session and we said, like, look, we only have 3 days. We don't have to, like, we don't want to go to, again, reading the pandemic accord as a book from beginning to end. So let's get in-depth conversation, and then that's when Article 11, along One Health, were selected. So we are 3 co-facilitators from 3 different regions from WHO. My other 2 co-facilitators are Philippines and Saudi Arabia, and then we're trying, like, to have, like, in-depth conversation. Of course, it's quite difficult, and it's quite difficult because you've already pointed out, because these articles is called co-development and transfer of technology and know-how. It doesn't say in the title IP, right? But when you read it, of course there is IP involved. And whenever because I'm not expert in tech transfer, and whenever you discuss these issues with experts of tech transfer, of course you need to have within the discussion the IP regimes. And those are discussions that had been taken for years in other forums, and not WHO. With the neighbor WTO, but not WHO. So, and what we try to do as co-facilitators is just try to decouple. I don't like the word decouple, because decouple means so many things in PAPs. But, but we try to get the conversation away from this binary conversation between IP regimes, mandatory and non-voluntary tech transfer. And that was hard. So we tried to move the conversation in terms of what do we mean by tech transfer? So we started asking states. No, first of all, we asked member states, because that wasn't clear if we needed an article on that. And everybody said yes. So we moved the conversation forward, and okay, what do we mean by tech transfer and co-development? And then, of course, we had to have the difficult conversation on IP, but then we tried to move the conversation on incentives, on how we can look at all those examples that have been working on tech transfer, and how can we move those examples into the pandemic treaty. So that's the way, that's our approach, just trying to have the conversation on tech transfer, and of course we need to have the conversation on IP, but try to have the conversation on the really core of, obligations that will entail tech transfer. And what do we need from now onwards? I think we need to have the conversation going, and the conversation with the difficult issues in mind. Because this matter of the time frame that we have is a bit risky, because seeing that we only have 7 months, we could have the temptation of avoiding the most difficult issues at hand, because it's so difficult, perhaps we don't go there. And I come from negotiating BBNJ, and as you don't know, it's a treaty on oceans. It's not related to health, but it's basically quite related to health. So BBNJ stands for biodiversity beyond national jurisdiction, and we had the same exact conversations on access and benefit sharing, on tech transfer and capacity building, and even IP. And the conversation, we left behind some difficult conversations because we wanted to close BBNJ. And in here, the tech transfer conversation, we need to have it, because it's a different thing. Oceans in terms of resources, access to resources, and here we really need tech transfer in order to have the diversification of production for research and development, to construct capacities for developing countries. So we cannot evade those discussions. So I think that will be my advice. So time pressure is important, but also we need to have the difficult conversation if we really want to have an implementable and effective pandemic accord.
And how long did the BBNJ treaty take?
Don't answer that question.
You can plead the fifth.
Yeah, exactly. Lawyer now.
More than 7 months. Okay. No, thank you very much. I'm going to go actually a little bit out of order because I think you've made a very clear call. We need to have some of these difficult conversations about topics like technology transfer. Let me turn, Paco, back to you because these are the questions on which, indeed, the European Union has weighed in. What I'm wondering is, the Union is, of course, a union of 27 sovereign member states with a wide range of capacities to do research and development, to manufacture vaccines, drugs, diagnostics, et cetera, to transfer technology. What is your view on the feasibility of having a more meaningful, reliable commitment to transfer technology from member states? And is there a perfect alignment of views among the member states? If there are differences of views, how do you reach consensus within the EU?
Thank you. So this is a pretty broad question. And, actually, when you take a look at the EU, everybody is, like good journalists, and Suri is really pushing here, difference of views amongst member states, it must be a bad thing. That's what makes the EU rich. Yeah? And precisely because there are many different levels of, economic development as well, and many different scenarios in almost every aspect, I think, that is being touched upon by the pandemic agreement. It's precisely the fact that we have so many views around the table that when we come to a common position, it is a damn good common position because it has looked at a problem from many angles. And it can serve naturally as a basis for convergence beyond the EU, precisely because we have a diversity of views there. So member states are our most important asset. And this is what has allowed us to put on the table very ambitious proposals and very comprehensive proposals. So much so that we've been criticized sometimes, but this is too complex. Yes, but we've looked at all the angles. Yeah.
I believe I heard you say voluntary technology transfer
Absolutely.
Earlier. And what I'm wondering, I think there's been some debate around what does that really mean? Is that going to be reliable in the event of a crisis? Because I think for many countries that wanted access to technology in COVID, voluntary didn't deliver. And so while on the one hand it's difficult to compel technology transfer, on the other hand it's difficult to put confidence in commitments that are always described as fully voluntary. So what I'm wondering is there something that can be done, or do you think that, what can the EU do to provide further confidence that commitments by its member states and the companies and the technology holders that sit within the EU will indeed be willing to transfer technology if and when needed?
So I think that this is precisely one of the main stumbling blocks that we are going to be facing more generally in terms of potentially reaching an agreement by May. There are some aspects of the discussion which are divisive and for which you naturally have other parts of the multilateral system to deal with them. Steve was saying before, look, we have to support multilateralism in a time of geopolitical turmoil. Full agreement on that. Part of that as well is not trying to undermine the mandate, for example, of the WHO or WIPO anywhere else, because we would be undermining the very fabric of the multilateral system. So, and there, the point, I tried to reference this before, the point is going to be, can we achieve concrete results in a way that we do not have to get entrenched in these elephant traps, which will not get us to an agreement? And that's precisely what the proposals by the EU try to do. Because the trick here is to provide sufficient, to promote private and public investment on the one hand, and second, to really promote the voluntary transfer of technology with smart incentives. A system which stifles, in the long run, the power of innovation of intellectual property will be the worst thing that we could do for global health. Yeah. So, but there's space in the middle, and it's a space that we have already suggested, and we're certainly willing to explore. But always based on voluntary exchanges on mutually agreed terms.
Did you say small incentives earlier?
No, I said incentives.
Incentives, okay.
Smart incentives. Well, hopefully, because otherwise they wouldn't work.
That's where I thought I may have misheard you. Thank you for clarifying. Thanks very much. I'm imagining we can come back to this, but again, we could spend entire days only talking about tech transfer. Let me come back to Steve. So we're already beginning to explore, I think, lots of tough issues. We can't get into all of them now. I think one of the questions that has come up in discussions I've had, including with folks across the street, is what is the role of all of these different players, including the member states, such as those represented by Juliana, the Bureau, which you've heard mentioned a number of times. What is the Bureau? Who is this mysterious Bureau? And the Secretariat, which of course you're a member of, and I see we also have many members of the Secretariat, WHO Secretariat here in the room. Can you help us understand who is contributing what to the process? Because I think this has been, in some corners in any case, a source of concern, actually. And then I mentioned the protesters across the street. But if you could give us a picture of that, I think that would help at least a number of our audience members. Go ahead.
Sure, thank you. And I think maybe with Juliana speaking about the co-facilitators, you've already got a sense of the very important, indeed critical role they play. In a sense, co-facilitators are like the marriage counselors for multilateralism. And well, member states have to live together in finding ways to say, how do you feel about this? How do you feel about this? It can play a very important role, and I think it will continue to play a critical role in service of the Bureau. And to give you an idea what this mysterious Bureau is, the Bureau is an elected body. So WHO, of course, has 6 regions, and each region proposes a member of the Bureau. And the Bureau is there to keep its collective hand on the collective tiller of the INB, and of course there's one for the WGIHR. And they are guiding the process, but not making the decisions. Anything the Bureau does is a decision of the entire group, is the 194 member states, and then the participants in the drafting group. And they give the Bureau a mandate. And so it was the group that said, Bureau, please give us a 0 draft of the instrument. Bureau, please give us, after hearing everything we've said, a Bureau's text of the instrument. And it was the member states which said, Bureau, please propose to us for our next meeting a negotiating text for our continued work. And that is what's going to be delivered. It has to be delivered by tomorrow. That was the agreement. It may come at 23:59 hours, but it will come tomorrow, and it will be sent to all member states and all stakeholders. And then it's up to the INB to work on that and decide what to do with that and to develop it. And I think there probably will be, by popular demand of member states, a continuing role for the co-facilitators, because it has proved so helpful to get out of the construct of formal written statements being read to each other in this big room, and get into the context of a discussion which is facilitated, as the word provides. And then the role of the Secretariat, and we take this with the utmost seriousness, is to serve the process, to support member states, to support members of the drafting group and the INB in each process. Very important to this, we mentioned both processes, is that it is essentially the same core Secretariat team under the guidance of the Director General and Mike Ryan, who supports both the INB process, the Intergovernmental Negotiating Body, and the working group to strengthen the IHRs to ensure that there is crossover between that. And I'll just give an example of the importance of crossover. So you've heard discussion about this idea of equitable access to pandemic response products and ensuring that that happens at the proper time and in the proper way. So one of the issues is, what should the threshold for that sharing be? And this involves questions that relate both to the IHR and to any new agreement. The IHR, as we know, has a threshold of a declaration of a pandemic, of a public health emergency of international concern, a FIC. Should that also be the threshold for benefit sharing under the agreement or under the IHR, to be decided? Should it be something more than that? Mike Ryan, who may be here still, I'm not sure, spoke to the WGIHR the other day about the idea of a fake with pandemic potential being potentially something that could be advised by the emergency committee to the Director General as a possible threshold for actions for pandemic prevention, preparedness, and response, although prevention, as has been pointed out, is a much broader topic. Many, if not all of these things, have to happen at all times. And indeed, every draft of the instrument has said the pandemic agreement, as is also the case with the IHR, apply at all times. It does not kick in at a pandemic. So the Secretariat provides support in that sense. We provide the technical, the housekeeping, the legal support, but it is up to member states how they use us and how they take this forward. We take that with the utmost seriousness.
Thanks very much. I'm going to pose one last question to Lars. I want to pick up on this theme of the IHR and the pandemic accord side by side. Before I do, I just wanted to remind you that immediately after that, I will open up the floor for comments and questions from all of you. So please get ready. So we've been hearing indeed about both the IHR and the pandemic accord. We've been hearing, perhaps not so much today, but certainly during the process, how difficult it is for negotiators to deal with these parallel processes, especially for smaller diplomatic missions. This is, to my knowledge, unprecedented, that negotiators have to do something, negotiate two sets of rules, more or less on a very, very similar topic at the same time. And we know this is not what anybody wanted, but this was indeed the kind of result of a political compromise. Between those that wanted an accord and those that wanted the IHR. But my question for you is really, at the end of the day, for somebody who runs a public health institute, for somebody who will be responsible for responding, preventing in the future, what do you really need to come out of both of these processes? What is important that negotiators get done, whether it's in the IHR, in the pandemic accord, both? What is important to you?
First of all, not any public health emergency, as already mentioned, is a pandemic. So we need something, I think, below a pandemic, and that is covered probably not by the pandemic accord, but is covered by the IHR. So it's necessary to have both from my side of view. And the IHR is indeed a core instrument guiding the daily work of a national public health institute and the member states. And we have already approved instruments in enabling a transparent flow of information between us and our partner country. It's not perfectly binding, I guess, but it's there. In our reporting and as well really guiding and enabling trusted international responses. They have shown themselves to be excellent instruments for preparedness as well. It's not only for response, but as well for preparedness. And for one example I already mentioned this morning is the joint external evaluation processes, and I might say as well Germany has profited a lot from this. To put it short, the international health regulations are critical, and I think they need to be there, they need to be strengthened, and they need to be renewed in a way, but it's important. If the proposed international pandemic agreement will be adopted, the agreement could have, of course, significant implications as well to Robert Koch Institute's work in terms of pandemic preparedness and response, and this might include possible increased reporting requirements for public health emergency, enhanced surveillance systems for early detection of outbreaks, and this, of course, creates an effort of our side, manpower and finance, of course, improved laboratory capacity for rapid diagnosis of infectious diseases, and a strengthened collaboration with other countries and international organizations. These are important aspects that we support fully, but we should ensure that these two regulations are not competing or not putting extra burden on the member states, for example, through parallel reporting in different surveillance systems. This has to be aligned. And however, COVID-19 has also demonstrated that the really need is an investment of all countries to realize IHR, and this is, of course, will be true for the pandemic accord as well. And we believe that this will become even more relevant when we have an updated international health regulation framework and the new pandemic agreement.
Great, thank you very much. And how optimistic are you you'll get that based on what you've heard?
Yes, I'm quite optimistic because nobody really wants to do to double the work at the end of the days. And what is really needed is that it's not two separate processes, but there is a kind of clearinghouse that at the end it fits together.
They are indeed interlinked in multiple ways, and I hope we can get across the finish line for both. Thank you very much to all our speakers so far. With that, let me open the floor, and fantastic, wow, so many questions. I'll ask each of you to please be brief, and I'm going to get as much input from the floor as possible. We have a microphone. Where is the microphone? Yes, in the back. Let's start with the gentleman in the back, and then with this lady in the second row, please.
Thanks very much. Nigel Sizer with Preventing Pandemics at the Source. I think it's...
Oh, sorry, and please introduce yourself briefly before you...
Nigel Sizer with Preventing Pandemics at the Source.
Thank you.
For the second time.
For everyone.
Fantastic panel. It's great to hear the optimism, but I think we need to be realistic. And Swery, you were gently trying to prod the panelists to be a bit more realistic, I think, on some of the issues here. We're seeing massive lack of funding for the pandemic fund, and yet there's a need for enormous funding to come into this process to really start to shift the discussion and so on. The issues that Francisco was talking about and so on. So I think the more realistic scenario is that this is going to be extremely difficult to get agreement on by May in any meaningful way. That we'll be heading for something that's lowest common denominator, or almost meaningless, that doesn't advance these very fundamental issues that Stephen so eloquently listed we need to move forward on. So what's the plan B? What happens then? We have to be realistic and plan for that. What happens next if we don't get to where we need to get to in May? Thank you.
Thanks very much. What's the plan B? We're going to take a collection of questions. Yes, up here in the... Thank you.
Hi, Sam Rick with AVAC. People have mentioned the medical countermeasures platform, and we're routinely told that we should look to the INB process for more details on that. However, as far as we've seen outside of the room, since it's quite closed, that hasn't really been discussed in the INB at all. We're hoping that it is slotted in the supply chain provision, but all of the details that we're saying, oh, just wait for that, don't supersede it, haven't been discussed. So can you illuminate when and if that will be discussed, and whether we should actually be pursuing that outside of the INB process, or if we're supposed to wait, maybe tomorrow?
Great. Wait or go. Thank you. Right next to you. Thank you. And then we'll go to the middle, and then I'll turn to this side of the room.
Thank you so much. Courtney Howe from Stop AIDS. Just picking up on Stephen's comments around transparent and inclusive governance, just a question of how that's going to ensure meaningful participation of civil society and communities. So right now, for civil society, it's incredibly difficult to follow any of the negotiations. For relevant stakeholders, for organizations in official relation with WHO, we're so often limited to hearing the opening and closing sessions, which is so far from sort of meaningful participation. So how will the governance discussions learn these lessons from the negotiation process and make sure it is fully inclusive, particularly of communities most infected?
Great, thank you. And in the spirit, indeed, of having more meaningful participation, I think I'm going to take lots and lots of input. We'll come back for one round of responses from each of our four before we close today. But this way, we'll have a little bit more time to hear from all of you. I think I saw, yes, in the middle. Let's try to have some, yes, the gentleman.
Thank you, Andreas Wolf, Medico International. One question also on the question on how to bring this pandemic accord back to the countries that need to also ratify it. And the big question we have seen, and we just see outside our doors here, that there is quite a suspicion about also the intentions of what a pandemic accord would mean, what power would it give to WHO if these obligations would infringe on the sovereignty of countries. And we have seen this during the pandemic and after the pandemic. How do you see that countries are aware of this problem? Are they really willing to, it comes to the point of political will, to really see some of these sovereignty rights in case of joint action, transparency, and information and burden sharing and benefit sharing? Thank you.
Great, thank you. Let's see, right in front of you, and then I'll move to this side of the room.
Hi, my name's Ellie from the Action for Animal Health Coalition. I noticed in the areas where we need to find that common ground to meet the deadline by May 2024 that the actual preventing spillover of zoonotic diseases isn't mentioned in that list. I wondered why this is, and is this a current area of contention within the negotiations? Thank you.
Great, thanks very much. Up here in the front, please, and then in the middle. Thank you. I hope you're all taking careful notes or have excellent memories.
Thank you. Hi, Maurice Remy, University's Allied for Essential Medicine. At the end, you already mentioned the AHR discussions happening and your fear of having a double burden of reporting. I'm wondering whether there is also, because from civil society spaces, I've heard a lot of like the fear of avoiding certain topics not being included in both processes, while pointing at the other process to manage it. So yeah, I was wondering how you're dealing with that issue.
Okay, thank you. Yes, in the middle, and then up front. Thank you.
Hello, thank you. Vijay, I'm a journalist with the Health Policy Watch. So my question is follow suit on the realistic aspects. So all I hear from the panel is being compelled to be optimistic, but in reality, I don't hear any solid list of disclosures of stumbling blocks towards a reasonable agreement. So one that another colleague mentioned is One Health, which is not even touched here. And there was a lot of kind of dodging on what were the stumbling blocks. So I would be, on behalf of others here, grateful if we could have more answers on that, along with WHO's capacity towards getting this accord instead of a total chaos or discard or house of cards. Thank you.
Okay. Thank you very much. Yes, up here, up front. Yes, thank you.
Hi, my name is Smita Sadashivan. I am from the Civil Society Engagement Mechanism for UHC 2030. I'm the steering committee member for UHC 2030 for civil society. And I have a question like, what hope are the member states and the WHO giving to us, people belonging to vulnerable groups? Like Article 14 is talking about human rights already, but it is, the issues are beyond the general scene or the health scene. People with disabilities, families, everybody, died of suicide because they didn't know how to take care of people with disabilities, members with disabilities during the pandemic time because of all the restrictions. And similarly, when COVID happened to parents have to take care of children with disabilities, and children with disabilities were left alone without having any caretaker or whatever. So there are intrinsic situations, and we don't have data of people belonging to vulnerable groups. When a lot of awareness is happening, the awareness is not reaching vulnerable groups. So what is the hope or the stand towards accessible awareness that will reach multiple vulnerable groups, and to get disaggregated data from the community level so that they can be reached out whenever there is a disaster situation. And also, like Courtney said, how people with people with living conditions can be part of the discussion forums mentioned in Article 14. Otherwise, it will be only the government officials representing us and not us representing our groups. So what is the promise that the member states and WHO would be giving in that front? Thank you very much.
Right, thank you. We'll take two more. One, the gentleman here, and then I think I'm looking for a woman in the back.
Thank you. Piotr Kolczyński, the People's Vaccine Alliance. I would like to get back to the issues of equity provisions, such as compulsory technology transfer or automatic IP waiver, that are opposed by many wealthy countries, also because of the arguments of the pharmaceutical industry that including such provisions in the treaty could harm innovation and that industry needs profits to be able to prepare the world for future pandemics. And today we published data showing that during the pandemic, the last 3 years, the big pharma spent on enriching shareholders almost as much as on research and development. It is 380 billion, almost 380 billion just over the last 3 years for shareholders and executives. And I've got a question to Paco, because representing EU countries, are you convinced, or if not, what more evidence would you need that it is possible to include such provisions like mandatory technology transfer or automatic IP waiver and have the industry having return on their investment and healthy profit, which will be sufficient to keep medical innovation? Thank you.
Thank you. Last question in the back, and I hope you're all ready for targeted, quick, and on-point responses.
Hi, Nina Jamal from 4PAUSE. My question is related to equity. So operationalizing equity means protecting the most vulnerable people, and that will be most effective if we can protect them before an outbreak. So I wanted to ask about whether equity in the phase of primary prevention, prevention of spillover, is also on the agenda of the instrument. Thank you.
Thank you very much. Each of you has about 2 minutes.
Okay.
But our speakers were pretty concise, and I've had my short list of themes. I'm going to begin, Lars, with you, and please answer as many questions as you can, but I'd particularly like you to respond to the question about vulnerable groups.
Yeah, okay. I have to apologize, I'm not part of the negotiating process, so most of the I'm not able to answer to most of the questions. Concerning vulnerable groups, I guess this is an important question. What is at the end needed? At the end, the local governments have to be aware of the problem, and they have to act. So I guess what is or might be useful in this pandemic accord and in this pandemic agreement might be a special paragraph addressing vulnerable groups and to oblige member states to have to take special care of these groups. WHO probably is not, or the treaty itself is probably not able to implement locally necessary protection measures, but to oblige governments by the treaty to protect vulnerable groups, I think this might be possible. And of course, the general idea of the pandemic treaty is to prevent pandemics from getting started. What your initiative has already as well told. And I guess one really important thing, and this might as well in German, in European countries at least, there was a kind of discussion that, well, let the virus run through the population, we protect the vulnerable groups, and that's all in some of the European countries. And I think we have to be quite clear, this is not possible. So high virus circulation will always affect the vulnerable groups. So it's not possible to separate them completely, even if they get some isolation for weeks or what else. So the pandemic treaty itself and the idea of the pandemic treaty to prevent pandemics to get started or mitigate pandemics and to lower virus circulation in the population and itself is an idea that is quite helpful and is addressing as well the needs of the vulnerable groups, I guess. But nevertheless, additionally, we have to put a specific emphasis on vulnerable groups, and I don't know if this is already planned in a dedicated paragraph, but this might be an idea.
Okay, thank you very much. Juliana, let me turn to you again. Any closing remarks, questions you can respond to, and I think in particular questions relating to countermeasures would be particularly useful.
Okay, I want to make a reference on that and perhaps on the transfer of technology question at the end, if I may. So the medical countermeasure platform is an interim in medical countermeasure that is being discussed within WHO, but we already discussed it in the IMB too. So it's part of the articles of supply chain, and there are two co-facilitators dealing with that article. We have been discussing as a way to how to implement an end-to-end medical countermeasure platform that goes from, and that's the key discussion, from production to distribution. And there's many discussions within how to build that supply chain. But of course, the WHO is also working on that as an interim way, since they need to be prepared if a new pandemic arises. So we have two sets of discussion, but what we have requested WHO as member states is just to align that process with what we are discussing, and we are discussing it in depth within Article 13. And there's a relationship also with Article 11 on tech transfer and Article 11. So we are discussing these articles and all these interlinkages between 9, 11, and 13. 9 is research and development, and WHO. I think I'm not sure how much I can say about what we had in briefing, and we had a briefing on Friday. So we're gonna start working together by hand, the process of WHO and the IMB process, just to have these discussions, these parallel discussions. So on that, and perhaps on the issue of tech transfer. And of course, I get the feeling that we were all positive, but we were trying to be constructive. Like with our positivism, we were trying to be constructive too. So you heard us too, saying that all the challenges that we have been facing in the process. It's been 2 years, and I think it's been more, because within the pandemic, member states started to discussing how to implement and how to improve the regulations that we have to face emergencies. So it's been a difficult process, but we've been discussing this, and of course, you know that they say nothing is agreed until everything is agreed. So there are several stumbling blocks within member states, and you can see a clear divide between developed and developing countries. That's the reality, but that's a reality that and Colombia, coming from a developing country, the developing world, we try to see this process as we all need a clear set of rules. So it's in the interest of every member state and every person in the world to have clear set of rules in order to face pandemics. So as in terms of the stumbling blocks of tech transfer, of course you mentioned that it is an elephant in the room. We are clear that the divide is between compulsory and non-voluntary, or not voluntary tech transfer and voluntary tech transfer. So, and I'm removing my hat as co-facilitator because someone else from my delegation represents Colombia. I don't do it on the floor. And this is the view of developing countries. So we see that voluntary tech transfer is not enough. We have seen it, that it wasn't enough. So we're not saying that we shouldn't remove from the spectrum voluntary tech transfer. We're just saying we just need to take a look to different options, and those different options, of course, being that it had been included in WTO as Paco mentioned. It's not going against the multilateral agreements that we have in place. It's just try to put into place just to abide to those treaties because they haven't been used before. And so that's the reason why we have trying to be creative, if we can say that, of trying to have more than just voluntary tech transfer. So of course there are stumbling blocks, but here like what we're trying to do is just try to see ways to finish the processes. I think it's in everybody's interest that we finish the process and we finish them like in a correct way. So that's the positivism coming from. Like that's our message. But of course we have many things to work on. Yeah, thanks.
Thank you very much. Steve, to you, please feel free to make closing remarks, but in particular, I think it would be very valuable to hear your views on the question around civil society participation, the Plan B. Can WHO herd all of these cats? If I may paraphrase. Voila, yeah.
Okay, so yeah, so on Plan B, this is of course the predictable response for me. It's up to member states. What I can tell you this has already come up, the issue within these discussions, and member states have said, you know what, a Plan B too early may not be a good plan. So let's instead agree to continue working up to the 77th World Health Assembly, and even if it takes to 4 a.m., 5 a.m., before the 77th World Health Assembly that begins the last week in May, that's the current plan. And in fact, the PIP framework, which Suri referred to, was completed after an all-night session until 7 a.m. And I think BB&J, there's also utility to working through the night on these things. So that may be part of Plan A. On the issue of spillover, and not mentioned, but extraordinarily important in terms of prevention, as is One Health, as is health and care workforce. I'm listing the things that are all in the Bureau's text, so you can know that these all matter. That list of 4 that I was suggesting are particularly key areas to find common ground were set out because if common ground can be found in those areas, it makes more likely finding common ground in all these other areas. And just so you're aware, there are very important provisions on international collaboration and cooperation, on whole of government, whole of society approaches, on compensation and liability management, the idea that there should be injury compensation schemes in places of the world that don't have the benefit of them. These are detailed parts of the arrangement, which you can see in the Bureau's text. That is all very, very much part of it, as is One Health. Member states will have different views as to how they're presented and in what way and at what level of detail, and that's part of what's being worked out. The issue of civil society participation, absolutely key. We've seen from the Framework Convention on Tobacco Control how essential that participation is to the effective implementation of the FCTC. It will, I think there's, from the Secretary's perspective, broad support for maintaining that. We, and the Bureau is very aware of CSO access issues. The member states are as well. Member states decided as an unprecedented 2 global public hearings on this process at an earlier stage. But what will be very important in terms of looking ahead is the governance structure set up, whether there's a conference of the parties, how observers to that would work. Those issues are under discussion, it's part of it, and civil society in terms of looking at their role in other instruments, not just the FCTC, but that's the one within the framework we're talking about, will and should, from the Secretary's perspective, play a very significant role in those discussions. There's also awareness about the need to balance, on the one hand, member states having the space in which to discuss issues frankly, and access to the public and civil society. Bureau has worked and will continue to work to provide briefings. That may not sound like enough, but it is important so that there's awareness and transparency about what is happening. Suspicions about WHO. So very quickly, because this is an important one. There is nothing in any of the drafts that would give WHO Secretariat any supranational powers. It is not possible under the WHO Constitution. WHO cannot order lockdowns. WHO cannot issue vaccine mandates. WHO cannot have access without consent. This is built into the constitutional structure of the organization. The Secretariat is subject to the World Health Assembly, and the Director General is subject to the authority of the Executive Board composed of member states. So those issues are important to discuss because it's important to communicate to the public, to parliamentarians, that concerns about that are misplaced. They are not part of what is being proposed. And then finally, I think that was, is it realistic to conclude this? I think I answered that. Overall thought that if you put the issues that both IHR and the pandemic agreement into a even stronger rule-based normative framework, you get generational prioritization of these rules that member states agree on collectively. And that kind of prioritization, particularly as it's higher level, especially with an agreement under the WHO Constitution that is a legally binding agreement, like a convention, like a treaty, can sustain that prioritization over time. So that's a very important part of the support of the Secretariat and the DG for this.
Thank you very much. Paco, closing remarks. There was one question directed specifically to you regarding the pharmaceutical industry and its profits, but also it'd be interesting to hear your comment and try to respond to the One Health spillover questions, since you also flagged that earlier on.
Yes, absolutely. Let me start with that. One of the keys to the success or not success of our negotiations from the point of view of the EU and its member states is whether we will be able to cover all the core gaps that we have in prevention, preparedness, and response. Not in one, not in prevention only, not in preparedness only, not in response only, but across the board. Because otherwise we will have failed in actually getting our citizens and our systems ready for future pandemics. And this is why I'm going to criticize the colleagues a little bit here, but I love them, so they know that. And it's a little bit a pity that the only speaker here today that paid attention to the obvious, which is the fact that unless we look at prevention, linking animal health, environment, and human health, we will not stop the next pandemic. But I think that you know very well, you know very well the position that we hold here, and it's a position that we hope and trust that other colleagues will join us as we move on. Little fact, if you connect all the dots, United Nations General Assembly resolutions on PPPR, One Health, notwithstanding the efforts by some like us in the EU, One Health figures in a very limited fashion at the end. When the next pandemic comes, and we have millions and millions of citizens across the world dying, let it not be because we missed this one, please. Okay, that's point number one. Point number two, very, very important. We're being extremely pragmatic. These are the questions around technology transfer and intellectual property. We in the European Union, what we want to have is something that really works, not a false solution. Yeah? And this is why we're suggesting mechanisms which, by the way, are working already. So I take issue with what Juliana was saying before, are working already and working relatively well in terms of technology transfer, for example, in Africa. We have a space to exploit voluntary technology transfer. And there is space, and we will support the full use of flexibilities in the WTO rules in order to make sure that technology transfer is indeed a driver for our defense against pandemics. But what we're not going to do is go to the false solution of pretending that by undermining the role in innovation of the pharma industry, we're going to get to a better place. Nobody else will do it otherwise. Finally, let me take a couple of points. MCM platform, just to complement and agree with Juliana on a couple of issues. First of all, a permanent MCN platform of sorts is embedded in the pandemic agreement. The discussion, and we're trying to see a little bit how to put it together, the discussion is what happens before the pandemic agreement for the moment. And India, South Africa, and Norway have been rightfully telling us, why don't we set up an interim platform in the meantime, using the convening power of the WHO, because we have no safety net if we have a pandemic tomorrow. These arguments have been very convincing, and therefore the European Union and its member states have been supporting very much this endeavor. And we find it a little bit of a missed opportunity that we haven't actually get this fully into motion. But we stand ready, of course, to continue discussion with other partners, because until the pandemic agreement is in force, we do not have. Plan B. What you have seen around the table is, you can term it as optimism. What you have seen, though, I think is more a realization of how important our shared interests are in this area. And therefore, a real constructive approach around the table. This is too important to fail. Time will tell whether we get there, but we're certainly going to give it our first shot, and the EU is fully committed to this process. Thank you.
Thank you very much. We've gone a few minutes over time. We started a little bit late, so thank you for bearing with me and your patience. I'll be very short in closing up this event. I think we've had a very wide-ranging discussion. We've touched on many, many issues relating to the pandemic accord, where we are, where we're going, and how long it might take to get there. From my perspective, I think it's very clear this is an uphill sprint with plenty of barriers and obstacles along the way, many of which you've already touched on, including access and benefit sharing, anything having to do with medical countermeasures, whether it's IP, technology transfer, stockpiling, research and development, local production, you name it, always a difficult issue. One Health, I would agree, is actually a difficult issue, partly because it is very much linked to financing. And for me, these are the four stumbling blocks. But as you've heard, there's a wide range of opinion on this. I hope this has been Indeed, I hope we've lived up to the ambition for this to be an informative and frank discussion. Please join me in thanking our fellow audience members for your excellent questions, our panelists for engaging so openly. Last but not least, thank you so much. I want to thank the World Health Summit team, Katja Thielmann and Björn Kummel and his team for all the support in pulling this together. We have a sprint ahead of us until May. I hope everyone will help us get there. Thank you.